Medical Dilemma.
Welcome back to the third segment of Medical Dilemma. Before we start this segment's discussion, I'd like to say thank you to our major sponsors, St. Clair's Medical Center, Makati Medical Center, LifeQuest Training and Consultancy Corporation, and its partner Manila Workshops. Now, in the third segment, we still have Dr. Hernandez King and Attorney Lourdes Pagayatan, okay, joining our co-host, Attorney Sara Sugitan and Attorney Teresita Sanchez. Okay. Welcome back to the show. Now, I'm about to turn 60 in a few more years.
Oh.
And so,
Akala ko a few more months.
my first question is, what lifestyle changes should I watch out for?
Is this addressed to Attorney Lulu?
To anybody?
Oh, Lulu muna. Wala pa experience si Doktora dyan.
Attorney
Yeah,
Lulu.
Actually, I can't say much about the medical part of it, because as I have said earlier in the previous segment, I think I am a healthy person. I have been a healthy person, and God has given me good health up to this time of my life. So most probably, from the layman's point of view, all you have to do is, if you were doing hectic schedule, hectic work before, you should lie low
Slow
a
down.
little,
Slow
go
down a
slow
little bit,
down, and think of the positive side of being a senior citizen. You look forward to it with great anticipation, happy anticipation, because you will be enjoying it, I assure you.
I see.
So,
Now, yes, Doctora?
Yeah, maybe for the seniors, they should have regular checkups. That's one thing, because cancer and all the other opportunistic infections, they usually crop up as you go older.
As you get
So
older.
it's nice to monitor yourself every so-so.
Yes, actually, to be more specific, I'm worried about developing cataracts now because you mentioned
60
nobody
and
can
above.
actually avoid it. Okay. Now, what if I develop cataracts in both eyes? Can I have them operated on simultaneously?
You mean as in one sitting?
As in one sitting.
It is not the practice to do surgery in both eyes, bilateral cataract surgery, because you're risking two eyes at the same time. I mean,
Yes.
that's very risky. So ideally, we wait for around 2 weeks or so to make sure that the first eye has recovered very well, that we would know the actual refraction of that eye, and before we even consider touching the fellow eye.
I see.
But then there are instances when some surgeons would agree to doing bilateral cataract surgery, but these are very rare. They're very rare. It's case-to-case basis.
Because sometimes the patient would request for it, no?
Yes.
They're running after a certain schedule, going abroad or something like
Exactly,
that. And so
yes.
they just meet halfway.
Now, how do we, I suppose you would dissuade or discourage a patient from having what you call bilateral cataract surgery?
I would. But even if the patient would say that I need to fly back to Guam in next week, I think that's not prudent, because as you know, even if cataract surgery is easily done now, it is not without risks. And we want to know the actual refraction of the eye, or the actual outcome, so that we can plan better for the next eye.
I see. Now, supposing I consent to having cataract surgery, will such a procedure simply restore my functional vision, or can I ask to go one step further, make my vision perfect?
When we do cataract surgery, our goal is always to make it perfect.
To make it perfect,
That's
no matter
the goal.
what the age
That's the
of the
idea.
patient is.
Yes,
Yeah.
yes. Of course, before the surgery, we assess the patient so that we would know the prognosis, or what would be the possible outcomes. If the outcomes, or if the surgery itself will really benefit the patient, we push through with it. And otherwise, if it's not, then
You defer.
we
no?
defer. Okay. So You're asking if we should always aim for 2020. That
Yes,
would be
yes.
ideal.
That's the ideal.
That's the ideal.
Okay.
So
But
that-
is it always possible in all cases?
There are instances when there would be some problems in the eye, concomitant problems like diseases in the cornea or in the macula or in the retina that will not allow the patient to see optimally. So we need to inform the patient beforehand.
I see.
Yes.
You know, everybody, those I know, who had cataract surgery are very happy, because they see so many things they have not noticed before. But one thing, the next step would be to go now to a cosmetologist or a plastic surgeon kasi nakikita nila yung mga wrinkles nila.
The vision becomes so clear,
clear.
that they see their imperfections.
Yes,
so to
right.
speak.
Anyway,
That's true. That's true.
joke only.
Doctor, when you undergo a cataract surgery, is there a maintenance thing afterwards? Like, do you need to wear eyeglasses for a certain period? Are there prohibitions? No drinking, no smoking, no eating fatty foods? Meron po bang ganun?
Immediately after surgery, we would require the patients to put some drops and to follow up with us at certain periods of time. But then once you are healed, then there's actually no maintenance. There are different kinds of lens implant nowadays. There are multifocal lens implant that promises spectacle-free life.
So both reading and pag
Yes,
multifocal?
yes.
It's
But
more
this-
expensive,
Very
right?
expensive, though. I don't think this is still the norm. Because with the standard implant, the patient can still get the same clear vision, but then they will probably have to wear reading glasses afterwards.
Just reading glasses.
Just reading glasses.
But, immediately after surgery, can you see or not yet? Will it be covered or?
In a routine, uncomplicated cataract surgery, they're expected to see around 1 to 2 days after.
Very clear. But even from the start, after post-op, meron ka na nakikita
Yes,
naman.
definitely.
Not really completely
Blind
blind.
or ano?
Yeah.
Yes.
And then do you feel pain? Will there be pain after the surgery? Will there be difficulty to sleep or?
Some patients don't, I rarely hear of my patients complaining of pain. They would probably complain more of hyperacidity or sometimes headache after surgery because they were so nervous during the surgery. But
May I ask something? Because usually seniors na ito, no? Would you
Yes.
require like a CP clearance, something like that from the patient?
What's a CP clearance?
Cardiopulmonary clearance. Because sometimes, like when I had my cataract, I had experienced an elevation of blood pressure and it really went to 180 over something. So they really got worried with me. But I took something, took something, I ate food, so they could not give me any sedative. So would you advise any CP clearance?
actually, this is one of the points in cataract surgery that has not been settled. If you look at the medical literature where we base our recommendations to patients, there's a big study abroad that says that medical testing done before cataract surgery is not necessary because it does not really prevent morbidity or mortality. And sometimes in the Western countries where they practice defensive medicine, they would run a battery of tests just so.
Prior to the cataract
Yeah,
surgery?
battery of tests. Most of these tests are not necessary.
Yeah, because after all, it's
Irrelevant
just
kind.
located in the eye,
Right.
right?
And this is outpatient
Outpatient.
cataract surgeries. So they think it is the cost incurred is also not necessary. So if you look at their guidelines, they would say cardiopulmonary clearance should not be done routinely.
So
Yes.
again,
That is
depends
based
upon your
on the
doctor's
evidence.
discretion.
Yes,
Yeah.
but then personally, I would require my patients to see their internist or their cardiologist, most especially if they have had no benefit of a medical checkup in
before,
recent
yeah.
years.
Baka mamaya diabetic siya
Exactly,
or what, no? It
exactly.
can complicate.
Is there an age at which or beyond which cataract surgery should no longer be prescribed?
That's a good question.
It's not the age, it's the situation of the patient. Some
Okay.
patients may be young, but they are aged.
Young
And
but
vice
aged.
versa.
Bad
versa.
living.
Yes, that's
Bad
why
habits.
a patient should, a doctor should, it's the responsibility of the doctor to really assess the patient if this patient will really benefit or not. So,
So in other words, there's such a thing as someone disqualified from undergoing surgery based on, for example, yun nga, the body of the patient
I
will
mean, yes, you may reject a patient if you know that the prognosis will be poor or if the surgery itself will bring no benefit to the patient.
On record, doctor, what's the oldest patient who had cataract, more or less?
I am not aware of the literature. I mean, but in my own practice, the oldest I've done was 92.
Wow.
That's
92
because he
years
was
old.
mentally fit. He was very independent. I mean, yeah, he actually came to the clinic alone. He rode a bus, the Baliwag bus, and just had himself dropped at my clinic. So, you know that this person could
Very
still,
competent
yes,
and
yes,
very healthy.
yes.
But
So-
you'd recommend that when someone undergoes cataract surgery, that he or she be escorted by family members to and from surgery?
during the surgery.
I mean to bring them to the clinic and then to
Well,
bring them home.
It would also be good to involve the family. You know, the Filipinos are close-knit clans, so it would be good to have the children there so that they can
Give support.
give support and
Yeah.
understand the options. And sometimes when you talk to your patients, these patients might forget or might be nervous.
Meron na palang
Yes.
senior
So,
moments.
I would encourage that.
Pero as you said, no, the surgery, the practice has already evolved. Whereas siguro before it took a long time or it wasn't as effective. Unlike now, the technology must have changed for people to not be afraid anymore. Na this will be something that is that will have complications. Because I think a lot of people, those who are candidates for cataract surgery, would normally not want to undergo it. Number one, it's not emergency procedure, but number two, also from the lack of knowledge that the surgery, how the surgery will be performed, the effects, etc. So it has gone a long way.
It has gone a long way. A lot of things have evolved. Even our guidelines are still evolving right now. But if you say that cataract surgery is a minor procedure, or no, it's actually not.
It's not a minor
But
It's
is
procedure.
it
not
a
a
bread
minor.
and butter procedure? I mean, before you used to do error of refraction glasses, no? Even up to now, yes. But mostly optometrists are doing that. But what about this one, cataract? I mean, you do a lot of cataract surgery, right?
I have my
I mean,
own.
as a whole, eye doctors do a lot. That's their major operation, right?
That may be the bread and butter for some of my
for eye
colleagues.
surgery.
Yes, yes, that may be. That's why I think what is important here is to let the public know their options, so that when they see an eye doctor, they should know that this is normally not an emergency procedure. It's always an elective procedure. So they may decline, they may think, they might. But there are instances, though, that cataract surgery is necessary when it has complicated into glaucoma. That's very rare, though. But knowing our options is very important.
What if the candidate for cataract surgery is no longer competent to make his or her own decisions? So how do we go about that situation?
As I mentioned earlier, I would like the family members to be there so that there would be a surrogate decision maker for the patient.
So is there some sort of hierarchy or line that we have to follow when asking for the surrogate decision maker?
I believe attorney there is, right?
Yeah, there is the next of kin. But
Yes.
The
I think any
spouse.
relative adult competent person can do that also. But
But
the
we have
next
to
of
ask
kin
the
definitely.
spouse first if the
Yes.
candidate
The
is
spouse,
married.
then the
Ideally,
children.
yes.
Then
Yes.
if the spouse is not available,
Can we
Depends.
ask our lawyer, Attorney Lulu?
What's the question again?
Supposing do you have to bring relatives with you when you go for cataract surgery as you plan to do?
In my case, it depends on who is available.
Yeah, that's also important.
And
right?
yes, who could decide in my behalf. But in my case, I think I have to decide for myself.
Yes.
I would not rely on anyone else except myself.
But you wouldn't go to the hospital alone, right?
Of course, I have to be driven to the hospital. I have a driver, so who would drive me to
And
the
afterwards, you
hospital.
can
But then I
drive.
need, yes, I really want to have one of my sons with me when I undergo cataract surgery.
Attorney Lulu has an emergency doctor son, specializing in emergency.
Emergency
Sa
medicine.
ER.
Finished at your hospital.
Okay.
His 4-year residency has just completed it.
Yes, don't worry, the cataract will not be an emergency.
I know. I was told so.
If I push further the scenario, what if the patient is not competent, and then the surrogate decision maker says, yes, let's put
do
him
it.
or let him undergo cataract
Yeah,
surgery.
because she's always bumping into so many things.
So,
poor eyesight.
I mean, does it, yes,
Yeah,
is it
yeah.
automatic that the doctor accepts the decision maker's
Will you do it?
decision?
Well, the doctor has a role in the decision-making process because first he is trained
Mm.
to know whether these patients will really benefit. I mean,
Mm.
to detect, I mean, who among the patients will truly benefit. He may recommend, but then again, the final decision will come from the surrogate.
May I ask
Decision
Sarah, what do you
maker.
think?
But wouldn't
Because,
that
I think- I
result
believe-
to paternalism, like what we discussed last time?
I believe your question, I mean, to make it more concrete, for example, if the patient is, for example, mentally ill or
Yes, yeah.
or has lucid intervals,
Mhm.
no, or when does his or her decision become binding on the
That's
on the
right.
doctor? So as I said, there's a hierarchy. When the patient is competent to make the decision, then he or she will decide for himself or herself. But
During the period of
during the lucid
competence,
interval, yes. So ngayon, kung hindi naman, of course, if married, then the spouse. Na if single person, no children, then the parents. Or if he or she has children, then the children. Provided they're also of legal age and mentally capable to make that decision.
I see. It's just that, behind, I mean, in the back of my mind,
For a
if
future
let's say I am
senior.
a senior citizen already, and let's say I've lost my capacity to make decisions for myself, and so let's say someone else makes the decision for me. I mean, how do we know that the decision maker has my best interest in mind?
For example, may Alzheimer's, ganyan.
Yes.
Tapos the next of kin decides, pa-opera natin, pa-cataract surgery natin. So maybe, Doctora, do you have experience in
Yes, I've had experiences when a patient would come to me who would have probably beginning Alzheimer's or would have dementia. And as I said earlier, cataracts per se does not
emergency.
mean that you need to operate on them.
Mhm.
There might be some more serious concerns like their mental mental status
Yes.
to be concerned about, and most of these patients are with a companion or a caregiver. So how would an improvement in vision, I mean, do you
Yeah.
think that they would even appreciate
Mhm.
this improvement in vision?
Right. Oh, come to see. Yeah, come to see.
So why? And I think these are the vulnerable segment of the population that you need to protect more from unnecessary surgery.
Yeah,
Okay,
correct.
I see.
Yeah, I think
Yes,
si
yes,
Father
yeah.
mentioned that na I think in the medical field, for everything that you do, there is an equal and opposite reaction. Parang meron siyang
Yeah,
ganung
yeah.
principle. What do you call
Risk
it?
versus benefit.
Risk versus
Beneficence,
benefit. You always
yes.
have to
And
analyze
if
it
they are
under that
way
frame.
more
Non-maleficence, yes.
Yeah.
Yeah, if there is no benefit, then the chances are the doctor will not perform this or recommend the surgery. So you always
But-
have to weigh it.
Yes. But what if the patient, even though she has Alzheimer's, in her world, it's true to her, no? And she really wants that eye surgery because she doesn't see the world anymore. Malabo na talaga mata niya. So what do we do? Could you consider that?
We go ahead. We go ahead.
If there's really significant cataract and you think she would still appreciate that and you can still talk to her, then probably I would. And there are no other risk factors,
I see.
then probably I would.
Okay.
push with it.
Well, thank you so much, Doctora. We've reached the end of the segment. Now, before we say goodbye in today's episode, I'd like to have a few words from each of you. Okay, Doctora Sanchez
Oh, me
first.
first.
For a change.
Well. Okay, so, my advice is that when you're senior, etc., there are more ailments sometimes that come around or just sprout out, no? Especially the big C, what we call cancer. So we have to be very conscious and have regular checkups, really.
I see. Okay, Attorney Sugitan?
When it comes to senior citizens' rights, and also considering our culture, no, we should really treat them with respect, give them all the privileges that they are entitled to, and also hopefully the law will change. No, we will be discussing more about the hospice care, etc. But we didn't have time anymore. But always the underlying principle should be respect for the elderly.
Okay, we can take that up in another episode. I guess. Yes. Okay. Doctora Hernandez King?
Well, aside from respect for the elderly, it's protection of their rights and giving them all their options so that they can decide well for themselves.
And of course, our guest,
And-
senior
Yes,
citizen.
Attorney-
well, I'm just too happy to be with you guys today in this show. I enjoyed it, and I hope all senior citizens out there would also be looking forward, or would be senior citizens would be looking forward for all the benefits and the privileges that a senior citizen enjoys. So I prefer to call ourselves senior citizens, not elderly, because senior citizen is more social.
And we're very lucky, huh? The cutoff is 60 years old. And unlike in the States, it's 65 and other countries.
And also, Attorney Lulu would like to invite people to
Ah,
our
yes. Okay. Our association, the Women Lawyers Association of the Philippines, will be turning 75 this coming October. We'll be celebrating our 75th anniversary at the Manila Hotel, and everyone who is interested to attend,
lady lawyers.
please make all
Lady
lawyers,
lawyers
all
only.
women lawyers interested, please get in touch with our office at yes, okay.
Yes.
Yes.
We're at New Manila, right?
At New Manila,
Manila.
New Jersey Street, New Manila, Quezon
Yeah.
City.
Okay, thank you so
Thank you.
much. Yes, the elderly certainly deserve the best care that could be afforded to them. However, we must always make sure to truly look after their interests and not impose on them what we think is best. No matter how good our intentions are, we should never resort to paternalism. Thank you for tuning in to this episode of Medical Dilemma. If you have questions, comments, or suggestions, please email them to heavenlycrestproductions@gmail.com, and we will try to respond to all of them. Watch us again next week, Sunday, 6 p.m. here on GNN for another engaging discussion on Medical Dilemma. Help patients and families in crisis, be aware and show you care. Have an enlightened week ahead of you.
Medical Dilemma